Is it a good idea, do you think, to allow PBMs to buy up independent pharmacies and other pieces of the medical supply chain? I mean, should PBMs be purchasing pharmacies and purchasing doctors' practices in some cases and purchasing hospitals or merging with hospitals? Is that kind of consolidation vertical consolidation across the medical supply chain, is that a good thing for patients?
No, and we know this from various studies, including studies that we've conducted looking at patient outcomes. When that has occurred, outcomes on patients are worse. If outcomes for patients were actually better in terms of access, quality of care, and things like that, we would be having a different conversation. But instead, we're seeing the opposite. And in particular, it's because they're prioritizing kind of bottom lines. What can they do to be able to maximize profit instead of actually thinking about patient outcomes?
Let me read to you from a recent news article about private equity and their entry into the healthcare system. Here's a quote: "When private equity enters healthcare, closures are not side effects, they're the business model. Extracting value for investors comes at the cost of extracting access from patients." It seems like to me one of the big problems we have in our health system today in the United States is we've got a lot of companies and corporations who are rapidly consolidating, and they're strip mining the American health system for their profits, but not for the good of patients. So prescription drug prices keep going up, up, up. Access to those drugs continues to decline. So what are some prescriptions you would give us as policymakers to address these problems?
I know the committee, and especially you as Senator, have been talking about reforms to various parts of the supply chain, including obviously pharmaceutical companies, but also PBMs, right, to actually address this issue around consolidation. Obviously, regulation of private equity, right, because to having oversight of these deals, which has been happening in some states to some extent, but usually after there is some harm that's occurring to patients.